Hello student. Today I am going to discuss with you very important topic, that is sulfonilamide. The sulfonamides, it is the very important in your GPAT as well as NIPER examinations. So sulfonamides, what is the sulfonamides? So sulfonamides is antibacterial agents, as we know. So sulfonamide were the first antimicrobial agents effective against pyogenic bacterial infections. Okay, and it became clear that the pontocells was broken down. Pontocells means that it's a dye, and when it was broken down in the body to release the sulfonamide, which was the active antibacterial agent. Okay, so this is about the sulfonamides. So this is the introductions part that I've already told you, that sulfonamides were the first antimicrobial agent effective against pyogenic bacterial infections. And second point is sulfonamide is chrysoidin was to treat the experimental streptococcal infections in mice, and pontocell red broken down in the body to release sulfonamides, which is so the antibacterial effect. So, and sulfonamides, it's not only the sulfonamide, the sulfonamides and plus pyrimethamine, this is the combinations form. Okay, so combinations form is used in malarial patient. So this is the structures of sulfonilamides. So sulfonilamide and sulfonamide structure is the similar. The difference is that, so here's having the H group. Okay, if it is having the H group, then it is known as sulfonilamide. Okay, but here it's having the R group. But if here it's having the R group, then R groups, it may be CH3 group, CH2 CH3 group. It may be. Okay, then it is known as the sulfonamides. Okay, so this is the basic ring structures of the sulfonilamides. And so if we numbering this structure, means sulfonilamides, so this position is the 1, and this position is 2, this position is 3, this position is 4. This fourth number positions of the initial group it must be required, because it show the antibacterial activity. If it is not present in this ring, then antibacterial action will not be shown. Okay, so this fourth number position is must be required for the sulfonilamides actions. Then classifications. The sulfonamides further classified in fourth categories. Mainly it is the categories in 3 categories, and another one is the special purposes. So first one is short acting, and another one is intermediate acting, and last one is longest actings. And a special class has been done because they are of several actions. Okay, the short actings category drug is the sulfur reagents, intermediate acting sulfamethoxazoles, and longest acting, this is the sulfadoxin sulfamethoxyrazines. And special purpose means, for example, sulfacetamide sodium, it is used in eye conjunctivitis, is used in I conjugate. This is the sulfocetamide sodiums and sulfosalazines. Sulfosalazine, it is used in ulcerative colitis, and silver sulfadiazines and mefenides, it is used in burn cases. So these special purposes having the several actions, so it is categorized into special purposes. Okay. Then the main portion is that mechanism of actions. This is the very important. So sulfonamides molecular structure is similar to PABA, means para-aminobenzoic acids, and which is needed in the bacterial organism as a substrate of the enzymes dihydroteroate synthase for the synthesis of the tetrahydrofolic acids. Tetrahydrofolic acid. This is the tetrahydrofolic acids. Tetrahydrofolic acid, another name is the FH4. Okay, so tetrahydrofolic we should know. So first, PABA, para-aminobenzoic acids, and pterine. Okay, in the presence of pterine synthetase, it convert to the dihydroteroic acids. Dihydroteroic acids. Okay, dihydroteroic acids. Okay, and furthermore, in the presence of dihydrofolate synthetase, it will convert dihydrofolic acids. Then dihydrofolate reductase, it will convert the tetrahydrofolic acid. This tetrahydrofolic acid is the very important for the cell growth as well as cell divisions of this bacteria as well as in humans beings. So if the tetrahydrofolic acid is not formed, cell will not be grow or will not be matured. So this is the very important. So this is the very important for the cell division or the cell growth. So the sulfonamide, so where the sulfonamide actions is worked, so it inhibit this pterine synthetase. So if the pterine synthetase is inhibited, dihydroteroic acid will not be formed, and furthermore these steps will not be formed. So this mechanism actions acted by the sulfonamides. One is the trimethoprim. So trimethoprim we will discuss in the next video, because trimethoprim is plus sulfamethoxazoles. This is the combination form is the givens, that is known as cotrimoxazoles. Okay, so we will discuss in the next video about the details about the trimethoprims. Okay, so many here I have been given some of the points, that is many bacteria synthesize their own folic acids, which is similar to PABA, means para-aminobenzoic acids, and sulfonamide inhibit the pterine synthetase. I had been told that pterine synthetase, this is the pterine synthetase. Okay, so this is the pterine synthetase, and this is inhibited by the sulfonamides. So bacterial cell cannot grow further due to the lack of the tetrahydrofolic. Okay, and so here I have been given another point. This is the pus and tissues. Pus and tissues extract contain purine, thymidine, which decrease the bacterial requirement for folic acid, antagonize the sulfonamide actions of PABA. Pus is the resource of this PABA. This is the very important line in your the GPAT as well as in NIPAT examinations, because yes, directly question asked from these lines. To which substance contain purine and thymidines? That is pus and tissues extract. Okay, here directly question asked from this line. So this is the overall the mechanism of actions of the sulfonamides. Then resistance of the sulfonamides. So before we study about the resistance, we should know what is the resistance. So resistance means as microorganisms that are not inhibited by usually achievable systemic concentration of an antimicrobial agents with a normal dosage schedule. For example, in the first treatment, if you take 200 mg of sulfonamide, okay, if we give up before the dosing, before the full dosing of the sulfonamide, it may be cause the resistance. Okay, so that will harmful your body. So doctor will recommend the high dose. So high dose, it may be cause the toxic effect in your body. So this resistance of the sulfonamide caused by the mainly three process. The first one is the produce the increased amount of this power, and second one is their folate synthase enzyme has the low affinity for sulfonamides, and third one is adapt an alternative pathway in the folate metabolisms. So these three process to resistance of the sulfonamides. Then pharmacokinetics. So pharmacokinetic, what is the pharmacokinetic? We all of you know that what is the pharmacokinetics. Pharmacokinetic means what body does to the drug. This is the known as the pharmacokinetics. So sulfonamide, I've not included here any specific the THAP value, because the several category of this sulfonamide drugs having the several THAP value. Okay, so I'm not included here in the THAP the value. Okay, so sulfonamide cross the placenta freely because it is the lipid solubles, and then primary pathway of this metabolism is the acetylations. To remember, that is trick. It is just a trick. That is SIP. S for sulfonamides, H for hydrolygens, and I for isoniazides, and P for propanamides. So sulfonamides, because those substances having NH2 group, NH2 group, it will go to the acetylation metabolisms. So sulfonamide structures having the NH2 group, hydrogen having the NH2 group, okay, and isoniazides having the NH2 group, propanamides having NH2 group. So it will go, the primary pathway of the metabolism is acetylations. Okay, because it's having the NH2 group. Then key points I had already told you. The sulfacetamide sodium, that is in I conjunctivitis. So in I conjunctivitis, the sulfacetamide sodiums. In burn cases, we used, that is silver sulfur diazine and mefenides. Silver sulfur diazine and mefenide. And also we call it this sulfasalazine and mesalazines. And all sulfonamides are the bacteriostatic, and they cross the blood-brain barriers. And chloroquine resistance malaria, we used, that is sulfadoxins and pyrimides. This is the combinations form we use. So this is the introductions part and key points and pharmacokinetic of the sulfonamide. And in the next video, I'll cover the cotrimoxazoles and fluoroquinolones.